It's another day with the physicians where your health is our business. It's growth towards the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what you know is
You're welcome back to the next level of the regular program.
Cancer is, when someone first hears the word cancer, the typical feeling, the typical emotion is fear, right?
The healthcare system is complex and constantly changing. This has shown to be a barrier to care for people with cancer. Oncology nurses are fluent in this system and know how to navigate through it. With a cancer diagnosis comes many opportunities to get up close and personal with the healthcare system provider. The patient meets countless professionals, including doctors, pharmacists, social workers, dietitians, and administrators. But there is no one the patient will see more than the oncology nurse. Oncology nurses take on various roles within the healthcare system. They may meet with the patients to provide education on the treatment plan, access how the patients are doing at home, administer their anti-cancer medications or care for them while they stay in hospitals at their lowest points. Oncology nurses care deeply about their patients and are uniquely positioned to support those they serve, rendering quality delivery of oncology care. Today on your regular Health TV talk show, The Physicians, where your health is our business, we'll be talking about the Caregiver'S cancer experience, quality care, quality delivery of oncology care. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your anchor on this program. Today we'll be talking about the Caregiver'S cancer experience, quality delivery of oncology care. With me in the studio is a registered nurse of over 25 years experience. She worked as a medical and oncology nurse at the University Teaching Hospital in Sunrise, Florida, where she gained a lot of experiences in handling patients that have cancer. She's an expert when it comes to managing these patients. You can't take that away from her. She currently serves as the deputy head nurse at the Lakeshore Cancer Center here in Lagos. She is no other person than, most times they call her Nurse Cynthia.
Yes.
She is Mrs. Cynthia Ikejiani, Nee Nwogu. but she's popularly known and referred to as Nurse Cynthia. Welcome to our program.
Thank you very much. Thank you for having me.
It's a pleasure, really. I'm so excited seeing you after so many times of trying to get you on the program.
It's just been busy schedule.
I know, I understand, because especially as an oncology nurse,
yes,
you're not many.
We're not many.
So you have so many patients that you need to deal with. You also handle. So let's go straight to the question for our topic. We're talking about cancer, the caregiver's cancer experience.
Yes.
Quality delivery of oncology care. Let me first and foremost tell us about your job and what made you go into that particular specialty.
Thank you for this question. It's always a question that I come across all the time. Okay. You know, it's not like child and delivery. It's not an easy position or profession. So I went into nursing. My mom was a nurse, and that's not the reason, but I can see the empathy, the love she has for her patients. It radiated. It's so clear. And I just decided to go into nursing because of the care and love that I have for people. And it's been part of me, and I don't think anybody can take it away. As a nurse, it takes dedication, love, and empathy to do the job. So that's how it is. So yes. It wasn't easy. It wasn't an easy decision to go into oncology.
Yes, that's why I wonder, why did you have to go into oncology? Was there any experience, or you had a family or a friend?
I didn't have a direct family, but I know that we needed to spread this message that cancer is not a death sentence. Okay. So for me, it's not a one-man task. It takes the whole world to beat cancer, to spread the information, go out there for outreaches, pass on screening. So I needed to be there to tell people to do these things. Mm-hmm. So that's why passionately I took it up as something. Since I moved back to Nigeria, I saw that a lot of people were just going from one place to the other place without the real treatment. Okay. And by the time they go to a hospital, it's a stage 4. It's too late, or maybe it's harder to fight it then.
Maybe we're going to talk about stage 4, but before we get to stage 4, from your experience on the field,
yes,
or you're actually on the field,
yes,
what do you have to share? What do you see normally when you go out with respect to the support system?
The support system is, now it's beginning to go out there. People are now talking about it, but we don't have much of that support system. That's the problem. So a lot of people fall back in going to churches. There's nothing wrong with going to churches or imam or the traditional way. But the thing about it is, by the time they present to a hospital, it's already too late. Okay. So that's part of the reason why it's there. We're here to help them, because a lot of people don't know that we exist. There's an oncology unit that handles cancer. Okay. So people go to general hospitals and just see the general doctor, or to their chemist, or to their pharmacist, and they miss the point. So as a caregiver, my role is to tell people out there that they have help. Okay. There are people that are specialized in taking care of cancer, and not every lump, like I say, is cancer. Not everything is cancer. So you have to be screened, you have to be diagnosed by the right people, and then you seek for treatment.
So the way we have homes for the elderly,
yes,
okay, and the ones that also challenge, we have homes for them. So we also have places,
yes,
for those that need support.
Yes.
For like the oncology units, okay?
Yes.
Maybe a lot of our awareness needs to be made for people to know that these things, these facilities actually exist. So you want to tell us about the quality delivery system since you got back, okay? Yes. The difference between where you were and now, and what you think is what do you think is responsible? What can be done to make it better?
What I think is that we need to have more outreaches. Okay. We need to go back out there in the community and inform people that things like this exist, there are cancers, but they are not death sentence. Because before, I remember, once they hear that they have cancer, they go into their cocoon. Everybody shrinks back. You don't communicate. You don't even tell anyone. They die in silence. But our job for nurses and support group is to go out there, preach, talk to people, and let them know that with treatment you can beat this, you know. And the more knowledge, the more information goes out there to churches and schools, you know, gives us more chance to beat this
okay, so let's do something that is, I don't want to say practical now. What does it entail? A patient is diagnosed of having cancer.
Yes.
Okay. Stage 1, stage 2, stage 3, stage 4.
Yes.
Because we know the stage 4 is almost like towards the end.
Yes.
But we had survivors of stage 4 cancer.
We do, a lot of them.
A lot of them. That is probably because they got involved in this with support group, right?
Yes.
So I want you to just tell us what it entails from the beginning, from point of diagnosis, after diagnosis, what next? Because remember what happens, the moment the patient is told that you have cancer, first and foremost, the news, in fact, the way the patient reacts is even worse than the disease itself.
Yes.
So as the one who is on field, you want to tell us what it entails after the diagnosis, what next?
Okay, so after the diagnosis, that means you've done a lot of tests and you have been diagnosed. The best thing to do is, since it has been diagnosed as cancer, is to see an oncologist.
Okay.
Once you see your oncologist, the oncologist is able to tell you what treatment. Is it chemotherapy? Is it immunotherapy? Is it radiation? You know, whatever that needs to fight this, it has to be communicated. I always tell people, once you have this diagnosis, it goes hand in hand with palliative. And with palliative, you get all the information that you need. The next step is the counseling section. You sit down one-on-one with the patient. You have to understand that they've been given this big news. So you sit and you talk about them and let them open up. They tend to open up to nurses. Most times, after they've seen the doctor, tell the doctor everything that you think it's everything. Once they sit with the nurse, I had an encounter today. They start telling you more things that you couldn't even imagine. You know, so they open up to nurses because, you know, we have this listening ear. We have this time. So once they have the counseling section and everything is outlined in front of them in layman's terms, not the big English, you tell them what they need to do.
It's getting very interesting.
Yes.
Just hold it there. When we come back, we'll talk more about the home support.
Okay.
Because I need to understand if all cancer patients need to stay in hospital. Otherwise, what happens if they're at home?
Wonderful.
So when we come back from break, we'll talk more about the support system that we have, okay? And for those out there, it's a whole lot. Cancer is not a death sentence. So let's hear what you have to say about it. Cancer care. Have you had patients? Have you had siblings that had cancer? Father, mother, brother, sisters, or friend? How did you react? What support did you render? Let's hear from you. We'll be back after the short break. Keep with the physicians.
Yes, I've actually seen someone with cancer before, and actually it was cancer of the breast.
Yes, I have seen. I also have a relative that had cancer of the breast.
The question is two sides, in the sense that if it's detected early enough, it has. But if it's not detected early enough, if it has gone past the stage medically approved, it does not have a cure.
I don't think there's a cure for cancer.
I don't believe it has a cure, but I believe you can manage at the early stage.
Definitely. I have seen someone who survived cancer.
Though I've not seen the person, but I had someone that said his mother survived cancer.
No, I haven't.
Go for screening, especially for the women. We can go for breast screening, cervical screening, and seek medical help.
It's early detection.
If you go for regular checkups, it could be detected at the early stages and you could go for some treatment.
Welcome back. If you have just joined us here on your regular program, The Physicians, where your health is our business. We've been discussing the Caregiver's cancer experience. quality delivery of oncology care. And now Cynthia, as she's popularly called, has been telling us of her experiences, what she's been doing, what it entails to manage a patient that has cancer. And of course, it's not a death sentence. She even talked about those that got to stage 4, how they've been able to come back, you know. So it's good to be part of the support system, and we're actually enjoying it. So let's go back to Nurse Cynthia. So Nurse Cynthia, thank you so much. I said so much. You talked about the due drugs team.
Yes.
That is a good one too, you know. I want to also understand, for people that have cancer, for patients after the diagnosis, is it all of them that needs to be in hospital? And if they're not in hospital, what happens at home? Okay, because do you now send nurses to go with them, those that can't stay in hospital? Who are those that are qualified to be in hospital, and who are those that need to have the home care?
Wonderful question, honestly. For the diagnosis, and once that's made, we know that we are in for treatment. The treatment comes with ups and downs, side effects, of course. So we have pre-meds and post-meds for this side effect. But where it happens that the patient is quite sick, okay, we can send someone to the house to check the vitals. We can draw up your blood and see what's going on. Okay, we run it in our lab and we update. But if the patient is able and can walk around, they can still come to the hospital. But no, you don't have to stay in the hospital. Once your treatment is done, some people come from their office. They take their chemotherapy, whatever treatments they are, 2 hours later, they've gone back to the office. We always tell you to watch out within that 10 days to 2 weeks, which is your nadir period, which your labs can fall apart. So once that's the case, we try to tell you to stay away from crowd because your immune system is low at this time. So once the immunity is low, just like COVID came, you know, everybody's wearing masks.
Don't even do that. COVID came. Oh my goodness.
So everybody now is wearing masks, washing their hands, sanitizing, which is what we tell them. So once you take all these measurements, all these things that you're doing to prevent exposure, then you're fine. You can be at home.
Before you continue, because you just mentioned COVID, how did you manage during that pandemic?
It was tough.
Because it's actually scary. For people that didn't even have cancer, they were scared. Not talk of those that had cancer, diagnosed with cancer, having treatment.
Having treatment
we know
and
that
having COVID.
Having COVID. So how were you guys coping?
We tried. It was a collaboration between us, the patient, and the family. Some we had to tell them to stay at home because hospital was not the best place to be at this point. But at a point too, we had to close the door and do home care, masked up, did all the gown and everything for COVID. It was not easy, but the patients were very, very smart. They understood that the risk factor.
So they won't take more care.
They were drinking and vitamins and everything, boosting up their own immunity. They were ready. Sure. And they accepted that it's part of this. Some patients, we had to delay their treatment because their immunity is already compromised. So we can't expose you to any more chemo. It was rough, but we succeeded. We made it.
Congratulations.
Thank you.
At least they survived.
Oh my God.
I don't even want to think about that time at all because I had COVID.
I just got.
I had COVID. I was on admission.
I didn't get COVID when when it was crazy.
Yeah.
I didn't. I survived. I was beating it, you know, with all the. I was doing my steaming and everything.
Oh my goodness.
But when everybody relaxed, forgot that. I got mine. And I'm like,
where is it coming from?
I didn't travel last year because usually every year I leave the country. I said, because of COVID, I'm not going. I'm staying in my country. And I got it.
I had COVID. My husband had COVID. He actually had 16 cylinders of oxygen.
Really?
Yes. We were at the isolation center for 2 weeks.
Wow.
It wasn't funny.
But you made it.
Oh, I made it at least. In fact, what was it? Happy survivor.
Oh,
okay, so let's go back. You talked about end of life care.
I want to say congratulations because it's not easy.
Thank you. So let's talk about the end of life care.
Yes.
What do you usually give at that point when you know that this patient, okay, it's just we gotta go. So what do you do and how do you usually accept it? How do you break the news to the family?
Breaking the news is a tough one. I have a case right now. They're planning an 80th birthday party. It's supposed to be, I don't know if it was last Thursday or this Thursday. Everybody's coming from UK. everybody's coming from US for this party. I lost her today.
Oh no!
But it's still a good news because we prepared them. There was home service. There was a nurse at home. There was you kind of open up and you tell them, you know, one-on-one, just the way we are sitting. It's not something you pass, you say, your mom is about to die. No, you sit and you let them think about the things they've done. There has to be a closure.
Wow.
They have to feel fulfilled that they've done the right thing. You know, they did their best. It's
for the dying?
For the dying.
Okay.
For the dying. Because that allows you to breathe and say, I did everything for mommy. The rest is for God. And the person that is going, once there's a stage 4, and it's not every stage 4 that goes.
Yeah.
But once we know we are going, okay, you communicate also with the patient. You explain. Sometimes they're happy. Most times they're happy because they can put the house in order. Banking system will be fixed. Wills are written. Things are in place. Because, you know, a lot of our people, we don't prepare these things.
True, very true, very true.
We let it, but once we let it stay, it's not my portion.
It's cultural.
It's cultural. Nobody wants to talk about it. But it's something that we do talk about it now. We open up and we let them know. We're not God, because we can prepare you and God changes things around. But at the same time, because with the end of life and breaking bad news has become like part of the care, part of the palliative. So when you're doing the counseling, when you're talking to a patient, you make them understand that this chemotherapy is to help you, especially if it's end stage. The rest is for God and your faith. Some people are very, very willed. They are very righteous. They believe so much that they will be survive. They will survive.
So, but you think the will has a role to play in this?
Yes.
Somebody's will.
Yes, yes.
So the fight.
Yes, you have to fight.
Yeah.
You know. It's,
well, I had a guest here on the program.
Yes.
A stage 4 cancer survivor.
Wow.
And. Lovely lady. She's also a medical doctor.
Okay. She's a young girl.
Yes.
Yes. She's our patient.
Oh, really?
Yeah. She's a survivor.
Lovely.
I'm telling you.
She told us her experience, how she was going. She talked about the family support.
Her dad is wonderful.
That was what she said.
Oh. We sit down like this, you know. She came to Lakeshore and she made it. So whenever I see her, she's part of our due drugs. So she uplifts the people. You know, she just wrote a book. So there's always...
She actually donated the book, some of the books.
Wonderful.
And we've told our viewers out there, is those that are able to answer the questions, we'll give them some of the books.
Wonderful.
Lovely.
So that tells you that cancer is not but the dead centers. But you have to be associated with the right group. The right people, right oncologists. We have Dr. Iwuji and Dr. Jimo. Dr. Jimo is wonderful, wonderful doctor. Dr. Iwuji just moved from UK to Nigeria, just like me.
Is she Nigerian too?
She's Nigerian,
wow,
and she relocated to help the people, the indigents.
We need more of the doctors to really come back.
Honestly, while people are doing the other way, she did like this way,
like you did.
Like I did. So I mean, somebody has to be there for. This is my home.
Yeah.
I love my country, you know. So if not the situation of things, man, this is where you come and you eat nkwobi and you're relaxed. Nobody will be asking you any question, you know. Acceptance is number one key, I tell people. Once you accept that, oh, that's a diagnosis that the doctors have told me I have, the battle is easier.
Okay, so in handling these patients, do you have your low moments? At the time, do you have your low moments?
Yes.
You want to share with us?
There are low moments whereby I just go in the bathroom and shed my tears. I'm human.
I know.
So it's not easy. I come home. I have a supportive family. Oh my God, my husband is wonderful. He hears me. I take calls in the middle of the night. He has never chased me out of the room because I answered a patient's call. So once I get my satisfaction from answering to patients. That's my moment. I'm happy. I'm doing this job. This is one job. When I relocated from Canada, because I moved from US to Canada, Canada to Nigeria, I noticed I'm very comfortable where I work because the practice is like abroad. So I'm very comfortable. So the thing is, I tell my nurses, please have empathy, have love, and your patients will pray for you. and you will succeed.
Okay, well, thank you so much, Cynthia. Thank Cynthia for coming to our program. And the take home here is ensure you do your test.
Yes.
Don't let that little thing take you to the other side.
No.
Do your best. The way will always pull you through. Thank you again for coming on our program.
Thank you for having me.
Out there, thank you for staying with us always. And ensure you follow us on our social media platforms, on Instagram, on YouTube, on Facebook. And if you want to be part of this program, remember to just complete the form and send us an email. Then we'll invite you. I remain Dr. Martina Agbere. Stay blessed.
Hello everyone, my name is Dr. Izuhunwa Amadasun. I'm a medical doctor, I'm also an entrepreneur and author. And today I've been talking about my experience as a cancer survivor, sharing a lot about my experience, my journey with that whole thing, and it's really to enlighten a whole lot of people out there, for those who have been through cancer, those who know people who are going through cancer. This is really good and important information many people need to know, and these are the kind of things that we cover on the show, The Physicians. So do keep watching. This is a brilliant show.